The annual Nurses Conference is an opportunity for nurses to discuss the services that they provide and how to turn challenges into opportunities. Lack of qualified nurses continues to be one of the primary challenges, but nurses have been going around those challenges by filling crucial gaps.
For many years, this country has been without psychiatrists. Psychiatric nurse practitioners have been cutting costs in healthcare, in that nurses are out there in the community, they're in every health district, assessing patients, doing the mental state assessment, diagnosing and treating. It is far less than having psychiatrists, or far less that the country can afford. Two different categories of nurses. We could also talk about the certified registered nurse anesthetists. These are the nurses that will put you to sleep when you're in the operating room theater. There's a shortage of anesthesiologists in this country. So we have nurses there doing that type of work. Again, that's cutting costs. So nurses are on the cutting edge when it comes to quality care and being effective in costs. And we drive nurses to look at that.
But does cutting costs always mean being effective, or does it sacrifice the quality of service?
At the end of the day, yes. What to explain is that I will, and I have pledged for the rest of my career, to give a high standard of care. Ultimately, if I am put to take care of 7 patients, in contrast to the nurse who should go up to 3 patients, the proper proportion, the ratio of nurse staff to patient should be 1 to 3 at most. So we would expect that I cannot physically, humanly, in any timely fashion, give high quality care, that which I would have given to 3 patients, to 7 or 8.
And for that reason, there is a push to create opportunities for more qualified nurses.
The ministry assists us in providing certain resources, continuing education, scholarships for nurses. For example, they had an ongoing program with the nurse anesthetists and theater nurses, like the scrub nurses. And they're trying right now to launch the program for midwifery and psychiatric nurse practitioners.
Undoubtedly, there's a lot to be done, including cleaner, safe working environments.
It needs improving. It definitely needs improving. We do what we can do. Most often, the nurse will take a little bowl out, get the mop, take a little bowl, get a broom, clean down their area, but the place of work is deteriorating. Hence, a nurse cannot be expected to repair the tile, to paint the walls. So the conditions with the money that the government is spending on health, if it were spent wisely, should have been better when it comes to the place of work and the cleanliness, the upkeep of the buildings, the infrastructure, in that which the nurse has to work.
Despite plagued by challenges and budgetary constraints, there are some things to celebrate.
Our healthcare system has developed, but all in all, healthcare is evolving. Globally, things are changing, and as things change globally, we in Belize do change. We're abreast in terms of training, we're abreast in terms of our outputs, technology. If we have to look at our documentation system that is in place, we do have, if you have to compare with the Caribbean and Latin America, we do have a very adequate Belize health information system, and nurses do work that information system.
Reporting for News 5, I'm